Severe asthma affects a notable percentage of adult horses, around 15%, leading to a diminished quality of life, reduced athletic performance, and, unfortunately, in some cases, premature retirement or euthanasia. The primary cause of breathing difficulties during asthma flare-ups in horses is the narrowing of the airways, known as bronchoconstriction, and an exaggerated response of these airways to inhaled environmental triggers, a phenomenon called airway hyperresponsiveness. Interestingly, administering bronchodilators, medications that help relax the airway muscles, often leads to a substantial improvement in lung function, sometimes as much as 60 to 70%. This highlights the significant role of airway muscle contraction in the disease process. Beyond these acute episodes, there's also evidence of a persistent, albeit milder, airflow limitation in horses with asthma, even when they are in periods of clinical remission and exposed to fewer environmental triggers. Even in these calmer phases, bronchodilators can still have a positive effect, suggesting an ongoing underlying issue with airway tone. Furthermore, a common symptom in asthmatic horses, coughing, is itself a neural reflex, indicating the involvement of the nervous system in the disease. Intriguingly, airway hyperresponsiveness can sometimes be observed even when there's no active inflammation in the lungs. This observation suggests that other mechanisms, apart from inflammation alone, might be contributing to the development and persistence of this exaggerated airway reactivity, and nerve activity is one such potential factor. Research in humans and mice has shown that the sensitivity to inhaled allergens and the contraction of the smooth muscles surrounding the airways are largely controlled by sensory nerves, including myelinated A fibers and unmyelinated C fibers, as well as efferent, both myelinated and unmyelinated, parasympathetic nerves in the airways. It's hypothesized that disruptions in this intricate airway nerve network could contribute to airway hyperresponsiveness, bronchoconstriction, and even the structural changes in the airways known as airway remodeling. For instance, studies in mice have indicated that acetylcholine, a neurotransmitter released by nerve endings, can increase the mass of airway smooth muscle. Moreover, in dogs, a surgical procedure called vagotomy, which involves cutting the vagus nerve, has been shown to prevent airway hyperresponsiveness and inflammation. This further underscores the importance of neural pathways in respiratory health and disease. The impact of altered nerve function might not be limited to the bronchi themselves. In humans with asthma, an increased presence and branching of nerves containing substance P, a signaling molecule, have been observed not only in the airways but also in the blood vessels and glands of the lung tissue. The nerves of the respiratory system, both those that send signals to the brain and those that carry signals from the brain, primarily travel via the vagus nerve. These nerves are crucial in regulating not only the tone of the airway smooth muscles and breathing patterns, but can also influence blood vessel tone,